Welcome to this video presentation of our CHIWORK paper, The Hidden Technological Labor of Service Workers in Health and Beauty Shops. My name is Janice-Lena Meissner, and I am a human-computer interaction researcher at TU Wien and the first author of the paper. The paper discusses a part of an interdisciplinary research study, which I conducted together with social scientist Nadja Bergmann and Nikolaus Bretterhofer and architect Edeltraud Haselsteiner. Our project was a feminist exploration of the digital transformation of service work. Occupations such as in retail, home care, and hospitality tend to be framed around working with people rather than with technologies. Many of these jobs also tend to be female-dominated and underpaid, and it also happens that not much academic attention has been paid to the impact of the digital transformation on non-technical, low-wage service jobs. Our research addressed this blind spot, and we asked, which technological labor do these supposedly non-technical workers perform on a daily basis, and why is this dimension of their work so often overlooked? In our CHIWORK paper, we focus on retail employees in health and beauty shops. We conducted a case study based on ethnographic visits to shops, interviews with retail employees in different job roles, and analyzed job advertisements and online services of health and beauty shops. I need to mention here that we conducted this case study in Austria and that there are some cultural differences between Austrian health and beauty shops and, for example, chemists in the UK or drugstores in the USA. The main difference is that these shops do not include the pharmacy and that they operate more as specialized supermarkets. They offer products like sanitary articles, over-the-counter healthcare products, cosmetics, household items, and health food. Given this specialized range of products, which often happen to target female consumers, health and beauty shops in Austria might be culturally framed as shops for women, a stereotypical label that also affects those people working in the shops. Statistics confirm that these workers indeed operate in a female-dominated, low-wage profession. Last year, 98% of starting trainees in this profession were female. And at the same time, retail employees are in the lower third of the national income scale in Austria. The job advertisements we analyzed indicated that a health and beauty shop assistant can expect to earn around 1,400 euros net per month for full-time work. This salary stands at approximately 17% less than the average income in Austria. Within this gendered and supposedly non-technical context, we looked for any traces of technological labor. As we describe in the paper in more detail, we define technological labor as either any professional activities employing digital tools or any work-related interactions which are impacted by digital technologies. This is a working definition in which we combine various sociological definitions of work with related concepts in HCI and CSCW. In our qualitative data, we looked for any instances that might fit this definition. We categorized them in terms of digital competencies based on a framework and documented additional skills not covered by the framework. In this way, our study results highlight the versatility of the employed technologies and illustrate the complexity of the performed work tasks. In the paper, we describe them as technological labor performed at the checkout, for example, in form of taking payments with ECR systems that accept multiple cash and cashless payment methods, as technological labor performed at the shelves, for example, in form of using smartphones and handheld scanners for managing the inventory, and as compensation work dealing with technical issues, for example, when a new product is missing in the ECR system. Our findings also describe the ways that technologies are an integrated part of the workers' interactions with customers. We saw tools assisting workers in customer support, workers guiding customers in accessing digital services, and an immense degree of emotional labor in the face of technical issues. We also summarized the technologies we observed in health and beauty shops in 4 categories. There were work tools, technologies embedded in the work infrastructure, external technologies brought into the shops by suppliers or customers, and background technologies, such as, for example, algorithms for personnel planning. We found that these technologies vary a lot in their levels of material and perceived visibility. Hence, we looked closer at those situations in which work routines using technologies were not attributed as work or played down, and related our insights to previous research on functional invisibility. In the paper, we offer a supplementing analysis of both willful and subliminal hiding mechanisms. We describe aspects of backstage work and maintaining a technology-free corporate image. And we also explore the impact of sociocultural value attributions. Here we note, for example, that health and beauty shop workers are potential targets of stereotypes, which categorically underestimate their digital competencies. In our discussion, we expand on these hiding mechanisms by contextualizing them within particular socio-technical dynamics. Here we address the potentially problematic influence of society having internalized the pervasiveness of technology and the special role that human compensation work plays in partly automated processes. In reference to the related feminist literature, we argue that these socio-technical developments tie into a legacy of gendered inequality. That is, female-dominated service occupations are naturalized and undervalued by attributions around so-called female workability. Our analysis confirms previous discussions of invisible work in that the use of technology tends to let existing forms of invisible work remain hidden, intensify their hiddenness, or create completely new forms of invisibility. In conclusion, our paper contributes a critical look that reveals some ways that keep the technological labor of health and beauty shop workers downplayed, overlooked, and undervalued. As is so often the case, technology should not be understood to be a neutral entity here. In Austrian health and beauty shops, at least, it seems to repeat a problem of gendered inequality.